Been dealing with pain for at least 6 months, been told you have tendonitis and inflammation. In this video, I explain why the problem actually isn't tendonitis, but something much worse. For those of you who don't know me, my name is Dr. Matt Maggio, and I'm a chronic pain treatment expert with over 15 years of experience in helping those with neck, shoulder, low back, and hip issues. So what does tendonitis even mean? It's basically anything with an itis in the diagnosis is just a code word for they really have no clue. It's really just saying that something is inflamed. Here's the thing, inflammation is the effect, not the true cause. So treatments that just get rid of inflammation, such as medications or injections, but don't address the root cause, can actually make the problem a lot worse in the long term. So if it's been more than 6 months and the pain is getting worse, it's more likely what is called a tendinosis. So what is it and how does it form? So a tendinosis basically over time is just called degeneration of the tendon. So when the muscles in and around the area start to overwork, maybe from an injury, maybe from repetitive use, they develop this stuff called adhesion, also known as scar tissue. It's like a glue that gets inside the muscle, makes it weaker, less flexible, and eventually it does get stuck to the nerve. So anytime force goes into that area, the muscle can't generate what it's supposed to, so it kicks it off to the tendon, and then the tendon gets overloaded and the body starts to kind of panic and freak out. And what it does is it sends out more substance to create the tendon, but it's not good substance. You can see here on the image on the right, it kind of looks like cooked spaghetti, where a healthy tendon should actually be what it is on the left, which is actually pre-cooked spaghetti. It's strong, it can handle force, it doesn't have issues in there. So why is it a big problem? Because 97% of tears were tendinoses to start. Why are they tricky? Because they actually feel better when you warm them up. So this creates a false sense that it's actually better. So how do we help fix it naturally? We start by unloading the surrounding tissue adhesions in the muscles, the nerves, and the fascia with precise and focused treatments. This allows the muscles to function better, move better, and have better strength. Then we work directly on the bad tendon to break down the tendinosis. Then once we do that, we help to rebuild the tendon back up with focused eccentric loading exercises. It's just a fancy way to say regenerating the tendon. So if you're tired of getting the runaround from other providers who talk a big game about how they can help to fix your pain, only to be worse off and lots of money and time wasted, and the problem is worse, then click the link in our profile to request a no-charge consultation with one of our providers and get some real answers as to what is going on and on the path to finally getting some long-lasting pain relief and results.